We're talking about the battle against pseudoscience. From measles to COVID to vaccines, there's currently a lot of misinformation and misconceptions floating around about health topics.
Dr. Andrea Love is an immunologist and microbiologist and founder of Immunologic, a science and health education organization debunking false claims. She joins us this morning. Good morning.
Morning, Larry and Lauren. How are you?
Morning.
Good to have you with us. Let's see what's first on our list. The whole measles vaccine thing. First of all, how did this get started and get some traction? People may have missed the latest on that infamous story.
Yeah, so this started because of a fraudulent study that was published in 1998 in The Lancet, which is a very credible journal. It was completely fabricated data by a gentleman named Andrew Wakefield, and it told people that vaccines caused autism, specifically the measles, mumps, and rubella vaccine. The reality is the MMR vaccine has over 60 years of data showing it is safe, effective, prevents measles, and prevents all of the complications due to measles.
And on the measles, I may have mixed up my autism and measles vaccine story, but the measles story, there's a story out there that just by good nutrition you can lick measles or protect yourself from measles. Any truth to that?
If only it were that easy. You know, you can have the healthiest diet in the world, do all of the things to support your overall health, and that's not necessarily going to prevent you from getting infected with the most contagious human pathogen, which is the measles virus. The thing that prevents measles is the measles vaccine. The MMR vaccine is 97 to 99% effective, and it has prevented over 2.6 million deaths every year globally since the vaccine was launched.
There is a fantastic show on Netflix, Apple Cider Vinegar, about the role of influencers in terms of providing medical advice when they don't have medical expertise. In particular, this focuses on cancer and this push to say you can cure cancer with nutrition and eating healthy foods, and particularly, juices and other types of nutritional advice. In your opinion, when you see these types of stories, and this was based on a true story, how dangerous is that information? And because a lot of people look at this stuff on Instagram, on TikTok, and take some of this stuff and really apply it to real life.
Absolutely. And that is really the harm of this, because these sorts of claims are not only unfounded and have no data to support them, but they cause people to suffer and die needlessly. We know that cancer patients who forego proven treatments in favor of alternatives like diet and supplements have a 2.5 times higher risk of death due to all types of cancer. For things like breast cancer, it's 5.7 times higher increased risk of death compared to using proven treatments. On top of that, the 5-year survival rates of these cancers plummet, going from 86.6% for breast cancer 5-year survival down to 58.1% for people that forego proven treatments for alternatives. So these alternative cures aren't just scamming people, they're actually causing loss of life.
Fluoride has been in the news quite a bit. Some communities are deciding to ban it. There is a track record of places that have already banned it, and how have things turned out in those places?
Yeah, it's not great. So fluoride, we have over 75 years of data showing that fluoridation of water is safe, and the level at which it's fluoridated is not posing risk to us. This is 0.7 parts per million, so 0.7 grams per 1 million grams of water. An adult would have to drink over 350 liters of that water in a day to even have a remote risk. Fluoride in water reduces cavities by up to 25 to 50% across all ages, and that's why it's considered a top 10 public health achievement. The issue is that this 2019 study was claiming that there was a reduction in IQ scores, but this was observational, and the methods used did not correct for other things that could impact their data. And these study results have not been reproduced. The reality is that fluoridation is going to improve dental health, which is going to improve overall health, and it's going to reduce overall healthcare costs.
Can I ask you about toxins? This is a word that keeps popping up, toxins, and I got to get my antioxidants. And is there any legitimacy to these things? Obviously, the words exist, but is there any legitimacy to it?
So the words are real and they have real meaning when they're used appropriately, but everything can be toxic at a certain dose. Even water. Water can be toxic if you drink 6 to 7 liters of it in a day. You can die from water intoxication. And so this phrase toxic gets misused to sell wellness products and scare people about things that are not actually posing a risk to your health at the levels you're going to be exposed to. That's why we say the dose makes the poison, because everything can be harmful at a certain dose, but everything can also be safe at a different dose. Unfortunately, this lack of context is used to scare people.
You can get more at Dr. Love's website, immunologic.org, and you can follow her on the socials. Andrea, thanks so much for joining us this morning. We appreciate it.
Thank you.
Thanks for having me.